The information shared on this podcast is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking care because of something you heard on this podcast. The views and opinions expressed by guests or hosts are their own and do not necessarily reflect the official policy or position of any affiliated organizations. Reliance on any information provided by this podcast is solely at your own risk.
Welcome to the Healthy Image Podcast. If you've ever been told that you needed an X-ray, an MRI, a CT, or an ultrasound, and you felt nervous, confused, or unsure of what to expect, this episode is for you. Today's episode is Radiology 101, where we break down what medical imaging really is, why doctors order these exams, and what patients should know before, during, and after an imaging appointment. We'll talk about safety, radiation, preparation, and common misconceptions, all in clear, simple language. Our goal is to make you feel informed, empowered, and a little bit more at ease the next time imaging is a part of your care. Let's get started.
Okay, so what is radiology and why is it a vital part of modern healthcare? Well, radiology is the use of medical imaging to see what's happening inside the body without surgery. So when you have something happening in your abdomen or in your leg that's bothering you or hurting you, doctors can't always diagnose it until they can actually look inside your body.
So they can actually see a picture of
Right.
what's going on inside.
Exactly.
Yeah.
That helps paint a picture and give them an idea of where your pain is coming from, or, you can diagnose diverticulitis or cellulitis, kidney stones.
Something as simple as a fracture and an X-ray.
Right.
Yeah.
So it does help doctors diagnose, which is where the term diagnostic imaging comes from. So when you're coming in for MRI, CT, ultrasound, that is
the main goal, to see the inside so the doctor can then give you a diagnosis and treat you.
Yeah, and it can help detect disease early. It helps doctors to come up with a treatment plan. It can track your healing. So say you've come in for imaging before, started some sort of treatment plan. Now you're coming back to see, is the treatment plan working? Is your body healing? Are things getting better? And it's better to come in at the start of whatever issue you're having, because if not, then your symptoms may become more serious if not treated.
Then you'll need further imaging.
Exactly.
Like extensive imaging, such as like a CT or an MRI, and even a PET scan.
Exactly.
Yeah.
Yeah.
Okay, what are the main types of imaging? X-rays, CTs, MRIs, ultrasounds, and mammography? Well, as we discussed, X-rays, they're quick.
X-ray is the first step to having other imaging if needed. They'll always start with an X-ray. And if they can't see what they need to see on an X-ray, then they might move to a CT, an MRI. But they'll typically start with an X-ray. A lot of insurance companies won't approve
additional imaging without an X-ray.
Correct. So if you need a high-tech exam such as an MRI or a CT,
they always ask for prerequisites.
Right. So when we reach out to the insurance company to get it pre-approved, a lot of times, 9 times out of 10, they're going to want to see your prior X-rays. So that's why
X-rays are needed before you can have like higher extensive exams.
Right, for the most part,
So a CT scan, it's a detailed cross-section imaging. It's great for emergencies. We do CTs on the head. We can do CTs on the chest, abdomen, pelvis, pretty much any part of the body just to see what's going on. We have MRIs that uses magnets. It's not radiation, to show the soft tissues and the muscles and the nerves. So I've had, I had a nerve issue with my leg one time, and they were like, let's go do an MRI. And I'm like, but why? And I was so afraid because I'm a little claustrophobic. But at the end, it was fine. They were doing my knees. It was fine. And it was actually really easy.
Yeah. I think the scariest part about the MRI unit, because there is this common
misconception.
I don't even want to say misconception, because if people are claustrophobic, like they are, like you can't help that.
That's true. They did give me like a 2 milligram of a sedative.
to help you like calm down.
Yeah, to just calm down. But they did put music on, and they did talk me through everything.
And it is just, I think it's just really loud. So you're in a small tube and it's really loud, but the techs can talk to you. They can hear you.
Yeah.
If you need anything, you just let them know.
There's a panic button, so it's okay.
Yeah.
They
You're
can
not
stop at any
actually
time.
alone in the tube.
Yeah.
Although the techs are on the other side of, the window, they're right there with you. They can hear you and see you and
They can monitor everything you're doing. Ultrasound uses sound waves, commonly used in pregnancy or organ exams. Have you ever had an ultrasound done?
I did it when I was pregnant.
Yeah.
And I did not know
What to expect?
what to expect. It was so easy.
They put like gel, I think.
Yeah. They
And
do
then-
gel and they warm the gel, so it's not.
Oh.
It's not. Did you not have warm gel?
It was cold. My
yeah.
experience was they slapped on the cold gel, and then there's like a little
mine was warmed.
probe that goes over you, and
Yeah, it's
You
like a
know.
metal wand.
yeah, and it just kind of glides over you. It's non-invasive. It didn't hurt.
No.
Yeah, it was.
And you can see in real time because they'll have the
They have
the screen there.
Yeah.
So yeah, I only had one when I was pregnant, and they were showing
The
like
gender?
the hand and
Well, look at the heartbeat.
yeah, like it's really cool. But you can
Okay.
see it in real time what's going on.
Yeah. Well, mammography, it's a specialized x-ray for breast health, and it helps with early detection because we know, as we all know, it saves lives. It's really easy. I haven't personally had a mammogram before. However, I did practice as a test person, and it wasn't that bad. They just do a top and bottom compression and then a 45-degree, and it wasn't that bad.
I've had a mammogram before.
How was it?
It was totally fine. I
Oh.
was really nervous. I mean, I thought, because I'm not 40 yet, so, but I thought I felt a lump. Well, I felt a lump. I didn't think. I felt a lump. So I went in really nervous. Mine was more of a diagnostic one.
Yeah.
But I was kind of excited to,
Have that experience.
Yeah, like,
that
know
you
what
can,
it felt like.
Explain to other people.
I am a very small-chested person, so I thought it was going to hurt a lot. It was totally fine. I not to discredit anyone's experience, because I
Yeah.
know sometimes, everyone's
Yeah.
different. But for me, yeah, it was. The most
easy.
uncomfortable part was just kind of being vulnerable in front of
Someone that you didn't know
someone
for
I
the
didn't
first
know.
time. Yeah.
But they were very professional. They didn't. I
that's
mean, they do
great.
it all day long. They
True.
don't.
They're like desensitized.
They don't care.
They're
Yeah.
like, I'm here to do a job and make sure I do it right.
Right.
And that's all I care about.
Yeah, and it was nice to get answers. So
Yeah.
it's like it was the stress of what is this lump was way worse than actually going to get
Yeah.
the mammogram done. So, and everything was fine.
Well, there you go.
So yeah, but yeah, and I know some insurance companies will recommend every 2 years for a screening mammogram. Here at Heal, we do recommend every year.
Single year.
Once you turn 40, every year your insurance will pay for a screening mammogram once a year. So every 366 days, you
You're
should
due
be
for
coming in
one.
for a screening mammogram. And here at Hill, for screening mammograms, you get your results very quickly. And then if there is follow-up care needed, we will help kind of direct that to be done. But 1 in 8 women will be diagnosed with breast
Yes.
cancer in their life. So just make sure you're getting in,
being
for your-
proactive.
Yep, and we
Making
have
sure you-
multiple locations you can come into for your screening mammograms. So
How does a radiologist differ from a radiology technologist?
So a lot of times, believe it or not, the patient will never see the radiologist.
No.
The radiologist is in a dark room in the back looking at all your pictures. The tech is the one actually performing the scan. So if you're coming in for a CT, the radiology tech, the CT tech, is the one actually putting you in the scanner,
They're asking you the questions.
just performing your scan. Those pictures that they get are now going electronically to the radiologist, who's now looking at your pictures, zooming in, trying to, again, find where your issue is stemming from, if it is, where the doctor's looking. So, again, you most of the time will not see the radiologist, but they are the ones that are looking at your picture,
They're the ones that are reading.
that are
everything.
diagnosing.
So, Veronica, at Hill, we have subspecialized radiologists. What does that mean?
So you have a radiologist, right? You have to go to school for X amount of years to become a radiologist. Now, if you want to subspecialize in an area, for example, a breast imager, they go to school longer, study all things breast. Then when they come, so at Hill,
Yeah.
if you're coming in for a screening mammogram, you're having a breast radiologist reading your screening mammogram.
So that means like I'm not going to have, say, a neural radiologist
Yes.
reading my breast.
Right. So you're
exam.
not going to have a radiologist who just read a brain MRI now come read a breast, a mammogram.
Yeah.
So
You get a clear image and a
right.
clear diagnosis.
So it just makes them more of an expert in that exact area. So if you do need a brain MRI, we have a neuroradiologist who's going to read that,
Yeah.
who's an expert in all things brain.
Yeah.
So they just have a better understanding of what they're looking for because they're looking at the same things all day long.
That's actually really cool. How do providers decide what imaging exam is needed for a patient?
You know, I think it just depends on the patient. The doctor has to consider the symptoms, medical history, what information they're needing in order to diagnose the patient. So if you're having abdominal pain, they're probably not going to order an x-ray. They
True.
might be ordering, depending on what quadrant the pain is, and they might be leaning more towards an ultrasound or a CT. Just depends on where your issue is. Again, your medical history, your
Yeah.
symptoms, that'll guide them towards what exam they think you might be needing.
Oh. Well, that makes sense.
Yeah. Do you know what the difference between a CT and an MRI
Well,
is?
a CT scan, they use x-rays.
Okay.
And an MRI, they use magnets, and you see different things. So for CTs, it's generally used for emergencies, so they want to make sure they have a clear image quickly. And for MRI, they show soft tissue. So it's just in great detail, and it doesn't use radiation.
So a CT is a lot quicker than an MRI.
Yes.
So, like we were saying, there's no radiation in an MRI scan because
Yes.
it's a magnet. There is in CT, however. Is radiation exposure from imaging something patients should worry about?
Well, how do I put it this way? Typically, someone does not regularly go get a CT done. Like, I would say the average person probably gets like maybe one, maybe two in maybe their lifetimes if they're a healthy person. The radiation levels are kept as low as possible and they're carefully monitored. For most patients, the benefit is getting an accurate answer that outweighs the risk. So I would say it's pretty low, unless you're a very sickly person and you're doing these regularly. I don't think typically patients do them more than 4 times a year.
Yeah. And even then, I think your radiation exposure
It's so
levels and they're
low.
being monitored.
Yes.
So if you do come in multiple times, they know.
How many times you've already been exposed. So then they give you a lengthier time before the next one is
Right. And they won't
performed.
let you go over the certain
Yes.
limit. Like if you've reached the limit of radiation, you have to have a different exam,
Yeah.
right?
They choose like other exams
Yeah.
to do instead.
And you're exposed to radiation just by going
All the
outside.
time.
By flying in an airplane.
Yes. Have you seen the X-rays machines at the
Yeah.
airports? You have to go like
Yeah.
this. Yeah, so you're always
Those things freak me
constantly
out for some
exposed to
reason.
radiation already.
Yeah.
So doing an actual exam that actually gives you answers far like, the risk and reward,
Yeah,
like you
risk.
kind of have to just,
Yeah.
it's worth it
Yeah.
to do one.
What role does contrast play in imaging?
Well, contrast plays a very big role in imaging because what contrast does, it highlights the blood vessels so the doctors can see more clearly. So some exams require no contrast, some do. Typically, they want to see the organs and the blood vessels to see like what's actually going on. So some patients might do contrast, some may not, but the patients that do need it, it's because the doctor wants to see a clear image. And also, prior to actually getting contrast, they ask if you're allergic to contrast, if you've ever done, exams with contrast, then you are screened way before, so there is no mishap.
So, for example, if somebody's getting contrast and they're being scanned, say there's some sort of blockage in your abdomen or something,
Yeah.
the contrast would stop. So then that's how they could see like, oh wait, something's happening here. The contrast isn't going through because it like highlights.
So it highlights in like when the radiologist is reviewing, your images, then they'll see like what is actually happening. So then with that image, then your doctor can further diagnose what's actually going on. Okay. As you know, patients will come in to do multiple exams. And are there different preparations for like an ultrasound or a CT?
Yeah, I mean, it depends on the type of study you're having done, the body part you're having done. Some studies will require fasting. Some will require you to drink a lot of water before you come in. Some require comfortable clothing. For example, we mentioned MRI, no metal, no zippers, no buttons, no, nothing with metal. So it just depends on the study that they're having done. But if somebody's giving you a prep, it's important to follow that prep because a lot of times the study cannot be done if you did not follow the prep. So I know sometimes it's uncomfortable.
Yeah, it's uncomfortable.
For
to drink,
me,
like, a lot of
if you're
water
making me
before.
fast, I'm so hangry. Like that's, you don't want to be around me if I'm fasting.
Try to do those in the first thing in the morning.
Yeah, exactly. Fasting exams in the morning. And then, if you have to drink a lot of water, it's not comfortable. And we get that. But in order for us to be able to see what your doctor's looking for, we'll need a full bladder. So there's just different preps depending on the exam and what the doctor's looking for.
Yeah.
What are the most common misconceptions patients have about imaging?
Many patients think that imaging is painful or it's unsafe, but in all reality, it's actually painless, it's quick, and extremely safe when performed properly.
Yeah. And at Hill, they make sure that they're following, they have
Protocols.
Safety Week every year where they're making sure everyone's following protocols, making sure no metal's being let into the MRI room. Like they are making sure that not only are the patients safe, but the staff is safe as well, that these issues don't come
occur.
up. Right.
Yeah. Veronica, as you mentioned, patients are supposed to be doing their mammograms every year. What are some of the benefits of doing mammograms every year?
I have heard, we've had 2 guests on our podcasts who, actually, I think 3, who were diagnosed with breast cancer with no symptoms.
Yeah.
No
family history.
No lump that they could feel.
Yeah.
2 of the guests we had, they had very aggressive breast cancer that if they had not come in for their screening mammogram, they most likely would not be here today.
Yeah.
Luckily they were very, what's the word?
Proactive?
Yes, thank you. They were very proactive about going in for their mammogram every year.
Yeah.
And, they had a very aggressive cancer found.
Yeah.
One was like in the way back of the breast where when she was doing her self-exams, she could not feel it. Even after she was diagnosed and knew it was there, she could not feel it. And her doctor said, like, due to the placement of the tumor, you never would have been able to. And once you did feel it, it would have been too late.
Yeah.
So there's things that go on inside of our bodies that we don't see or feel or notice, which is why these screening exams are important.
Yeah.
If you're eligible for a lung screening, like get it done because there's things, don't wait until now you do have symptoms present to go get these screening exams done, especially if they're covered by insurance. I totally get there's times where, insurance won't cover it and it's not feasible to go get it done. But in that case, as soon as you have an issue,
You should go get it done.
don't try to be tough and wait it out. Go see your doctor and talk to them about, next steps. If you need diagnostic imaging to find out why you're having whatever issue you're having, let your doctor know, be proactive and let them know that this is something you want done, but just don't wait until the issue is bigger than it should be.
Also, I want to ask you, what other career paths exist in radiology beyond becoming a radiologist?
Oh, before I got into radiology, I had no idea all the behind the scenes. You have the person scheduling the exam. Now imagine you're a scheduler. A patient calls in to schedule this exam, and you have to ask all these questions that you would never think to even that you'd have to know.
Yeah.
But you have to, know a lot about radiology in order to be
learn
scheduling.
the terminology, learn
Yes.
like different diagnoses.
Yes. No, the follow-up questions and things like that, the leading questions.
Yeah.
You have the people managing the centers
Yeah.
that also have to know a little bit about everything. You have the marketing team who has to go and make sure the referring community has what they need and answers any questions that they have or fixes any issues that they might have. And you have the IT department who I always joke, say like, I keep IT. Like, I am their
Busy.
job security because I need all the IT help in the world. You know, there's just so many, the tech aides.
Yeah. There's also like the behind the scenes
Billing.
people. There's billing. There's the authorization personnel. There's your checking in staff, your greeters. Like everyone works as a team.
And you have to all be working together.
Yes.
Like the billing team is working with the techs to make sure that codes are correct, and you know, authorizations working with scheduling, and also the techs to make sure things are scheduled correctly and approved correctly.
Yeah.
It's just a lot of behind the scenes. It's not just my doctor ordered this,
Here you
scan
go.
me. I wish it was that easy.
Yes.
I mean, it should be that easy, but unfortunately, with insurance companies too, it's like we have a lot of guidelines we have to follow, and it needs to be approved, so the patient's not having to pay this
Yeah.
astronomical out-of-pocket
Bill,
price,
yeah.
right?
Well, as you mentioned, all the different roles that could play into radiology. What are some of the skills or qualities that make someone successful in radiology?
You have to have really good attention to detail. You have to be very compassionate. I think that's the biggest one, empathetic. You have to know that a patient's coming in to most likely be diagnosed with something. And that doesn't have to be, you know, a life-threatening illness or anything,
Yeah.
but they're coming in for a shoulder MRI. Their shoulder's probably been hurting them for a long time, and they're frustrated and angry and upset.
Yeah.
And you know, it might not seem like the biggest deal, like, oh, it's just a shoulder injury, compared to a lot of things that we have seen.
Yeah.
But to that person, it's frustrating and it's
Yeah.
annoying, and we just need to be you need to be an understanding person.
Yeah, and be compassionate
Exactly.
to that person. There's other things going on.
Yes.
Yeah, there's always something going on.
I think another one is to be a strong communicator in radiology. I think in any job, when you're doing the same things all the time,
Yeah.
it becomes just like not a second thought. You just
Yeah.
do it.
It's just like redundant, like you've done this a million times.
Right, but the
like, doing
patient
it.
and the patient, it's new to them.
Yeah.
So although to you, you know what you're doing, it's very important to communicate to the patient what
Yeah.
you're doing, because they don't know. You know, they don't know why they're getting.
Just take that extra like mile. Like, you know, we have these reviews that we read all the time. I can recall one on top of my head where one of our technologists, our CT technologist, shout out to Sean, you know, he went up and beyond for a patient because she had complained like, hey, I had to take a $60 Uber here, but I wanted to use Metro and it was in Glendora. And he went ahead and helped her download the app, like put the Metro app on her phone so that she can get home like with $1.50.
Wow.
You know, that ride was like $60 from Pasadena
Yeah.
to Glendora is not like not everyone can afford that.
Yeah.
And so for him doing that, like I thought that was really great.
Yeah, just really going above and
Yeah.
beyond. Yeah,
He was great.
good job, Sean. How has radiology changed in the last decade?
Well, the imaging is now faster, it's clearer and more precise than ever. Advances have reduced scan times, improved comfort, and increased diagnostic accuracy. So, you know, machines are getting faster. There's more slices in CT. You know, you can do a faster MRI because of like the different protocols. We have 3D mammogram now versus 2D. We even have something up and coming. We're going to be doing CT DEXAs, which I've never even heard of. And so technology is getting better. So everything with the imaging side, like seeing the pictures, is just improving.
Yeah, gives the doctors a clearer image
Yeah.
of what they're looking for and can help diagnose things quicker and
Yeah.
easier. Yeah. What about AI? How is that shaping radiology?
Wow. AI, it helps the radiologist spot patterns, it prioritizes urgent cases, it improves efficiency. It doesn't actually replace the human expertise, but it does support things to help things better. It's better for patient care. So it's just a tool.
Yeah.
Because at the end of the day, the radiologist is the one that actually can read things clearer. The AI tool is just there to help.
Yeah. So if they're having a mammogram, because we have AI tools with mammograms. So if the patient comes in for a mammogram, it runs through this AI tool
Yeah.
Then it goes to the radiologist. So the radiologist is still looking at it, but it's looking like, oh, this AI tool wanted me to double check these areas.
Yeah.
Now, the radiologist still would have checked them,
Regardless.
but this kind of, I mean, it just
eliminates a little bit of the work.
right, and it kind of gives the radiologists a starting point. These are maybe the places I should be looking at
Yeah.
first, and then I can dig deeper.
Yeah.
But yeah, it doesn't replace the human.
The human
It just helps.
expertise. It just helps.
Yeah.
It's just like a tool. Like AI is just a tool. It does not replace anyone's expertise.
Yeah.
Yeah.
Another thing I wanted to bring up too is, I think there's this expectation of people in the healthcare industry. I mean, you go into a doctor's office and you see like a pharmaceutical rep, and patients have this idea that, the doctor is giving me this medicine because this pharmaceutical rep is coming in giving them medication and stuff like that. And it's, but when it comes to radiology specifically, there's a lot of rules in place, laws in place that prevent, or I wouldn't say prevent, it should prevent, but it's supposed to make it so that way there aren't you can't buy patients.
Yeah.
You can't.
It's like against the law.
It's against the law to do
Yeah.
that. So, like for the rep who's going into the doctor's office, they're not just going in and bribing them to send you a patient. It's, hey, what questions do you have about this? Or we just got a new CT scanner in Glendora. We wanted to let you know.
Yeah.
Call me if you have questions, if you can't get your patient in. There's just a lot of compliance that has to happen. And, we have a compliance officer who's making sure that from start to finish, from scheduling until the patient leaves us a review at
And
the
gets
end of the
the bill.
experience, that everything is in compliance.
Yes.
Every rule is being followed for the safety of
The patient.
and Hill and the
Yeah.
referring community. That's, I think, one thing that Hill does pride itself on is that they are
planted in compliance.
exactly 100%. If you're being seen at Hill, you are at a place where you have people, again, from start to finish, making sure that things are running smoothly.
Yeah.
And there's protocols in place to make sure that, again, rules are being followed, the patient's being taken care of,
Yeah.
the staff is being taken care of. It's not just, you're not just a number. You're not just coming in, scan, get out next. There's a lot of the behind the scenes that goes into
There's
it.
a lot of care and a lot of thought that goes into seeing the patient.
Exactly. Yeah. Well, I think that wraps up today's
Yeah.
Radiology 101. If there's one thing that we hope you take away, it's this. Medical imaging is a powerful tool designed to help doctors get answers early, accurately, and safely, and patients are never expected to navigate it alone. If you're preparing for an imaging exam, don't hesitate to ask questions. Speak up about concerns and advocate for yourself and your comfort. Understanding the process can make a big difference in how confident and calm you feel. Thank you for listening. If you found this episode helpful, share it with a friend or family member who might be facing an imaging appointment. We'll see you next time on the Healthy Image Podcast, where we talk all things health and wellness. And as always, stay curious, stay engaged, and stay healthy. Bye.
Bye.